I'm Norma Jean, and I'm a registered nurse.
All right, well, if you could summarize your image of nursing in one word, what would that one word be and why?
I would summarize it as the concept of patient experience.
And why would you use that word?
I believe that nursing has evolved into a patient experience over the years, especially maybe the last 11 years.
All right. Well, what does it mean to you to be a nurse, like as far as your core reasons for choosing to be a nurse?
I chose to be a nurse to care for people and to help people live a better, healthier life.
All right. What degrees and certifications have you earned towards your nursing career as far as like a timeline of events?
Okay, well, I started off as an associate degree nurse in 2003. And about a year after that, I decided it's time. I need to go back to school. I finished my Bachelor's of Science degree in nursing in 2007 and then didn't want to stop there. So now I have a master's degree, Master's of Science in Nursing and a Master of Business Administration and Healthcare Management. And I'm currently a doctoral student with the University of Phoenix for Healthcare Administration.
All right. Well, where have you previously worked?
I have previously worked in community hospitals in North Carolina and Medical University of South Carolina,
Okay.
and I'm currently with the Red Cross St. Francis.
All right, so that's where you currently work?
Yes.
Okay. What personal passions or interests made you want to become the clinical manager of women's services?
Well, I love developing people, and I feel if we have a positive practice environment, our patients are going to have a really good experience. And I love being a manager. It's going to help me attain my overall goal of leading an organization one day.
Okay, so that's managing. Well, what other job opportunities in nursing are you currently interested in, and why?
Well, I currently also teach ADN and Bachelor of Science degree students with local colleges here in the Charleston area.
Okay.
So there's so many opportunities in nursing. You can teach, you can be at the bedside, you can lead. There's so many opportunities.
Wonderful. Well, what advice or suggestions would you give a nursing student from USC that, say, like recently graduated as an RN with a BSN in regards to like available job opportunities, maybe what steps towards a nursing career would be next after graduating?
Well, I think the first advice I would give a brand new graduate nurse is to be very choosy about where you begin your career. Just as employers are choosy, you should also choose the organization. Look at their quality and quality outcomes. Go to hospitalcompare.gov. It tells you everything about how hospitals compare to each other because it's really about the outcomes and and what the patient experience is, and that's where you want to go work.
Okay. Well, what recommendations would you have for future nurses pertaining to education, the nursing career, just general advice, et cetera?
General advice, go into med-surg. Get as much experience as you can. Make yourself valuable so that you can move around an organization to different specialties and then specialize.
All righty. Well, thank you very much, Norma.
You're welcome.